Hello, everyone. Today we will learn about on-site first aid for electric shock and lightning strike accidents. We know that injuries from electric shock and lightning strike are both types of electric shock injuries. What symptoms might occur after an electric shock? The assessment of electric shock injuries involves three main aspects: systemic manifestations, local manifestations, and complications and sequelae. Let's explore these further. 1. Systemic manifestations. Mild electric shock. Individuals may experience fear, dizziness, fatigue, palpitations, pale complexion, involuntary muscle contractions, and various degrees of tingling and soreness. Severe electric shock. High-voltage electric shock, especially from lightning, can cause a sudden loss of consciousness, cardiac arrest, and respiratory failure. Some severe cases may initially show mild symptoms, but can deteriorate suddenly within an hour. Be alert for multiple injuries such as severe muscle damage, internal organ damage, and burns both inside and outside the body. Some patients may suffer from myocardial and cardiac conduction system damage. Large surface area burns or extensive tissue damage can lead to hypovolemic shock due to excessive fluid loss. Necrosis of muscle tissue resulting in myoglobinuria and hemoglobinuria after hemolysis can both cause acute kidney failure. Dehydration or insufficient blood volume can further accelerate or worsen the condition. 2. Local manifestations. Electric shock site. The greatest release of electric energy occurs, causing significant local tissue damage. Low-voltage injuries typically result in small skin wounds, 0.5 to 2 centimeters in diameter, which are oval or round, charred yellow or gray-white, dry, with clear edges distinguishing them from healthy skin, and sometimes accompanied by blisters. These injuries usually do not affect internal organs and have a low disability rate. High-voltage burns are more severe, characterized by larger and deeper wounds. Entry wounds are usually more pronounced than exit wounds, with the burned area appearing charred, potentially affecting blood vessels, muscles, and bones. Vascular damage can lead to multiple embolisms and necrosis. Muscle tissue damage, swelling, and necrosis can increase subfascial pressure, resulting in nerve and vascular compression, weak pulse, loss of sensation, and compartment syndrome. Lightning injuries. Lightning can cause branch-like or fine line patterns on the skin, which are first or second-degree burns due to the current flowing along or through the skin. Rings, watches, necklaces, or belts may cause deeper burns at the points of contact. 3. Complications and sequelae. Multiple systemic complications and sequelae often appear within 24 to 48 hours post-injury. 1. Circulatory system. Myocardial damage, severe arrhythmias, and heart failure. 2. Respiratory system. Inhalation pneumonia or pulmonary edema. 3. Digestive system. Gastrointestinal bleeding, perforation, or paralytic ileus. 4. Urinary system. Myoglobinuria or hemoglobinuria and acute kidney injury. 5. Hematologic system. Secondary bleeding, disseminated intravascular coagulation, DIC, or hemolysis. 6. Skeletal system. Fractures, joint dislocations, or a septic bone necrosis. 7. Nervous system. Ascending or transverse myelitis, multiple neuritis, or paralysis may occur days to months post-injury. 8. Others. Tympanic membrane rupture, hearing loss, corneal burns, retinal detachment, cataracts, and visual impairment. Secondary infections, miscarriages, stillbirths, or intrauterine growth retardation can occur in pregnant women. These are the assessments for electric shock injuries. What should we do for first aid after an electric shock occurs? On-site first aid measures include two aspects: disconnecting from the power source and post-disconnection treatment. First, let's discuss specific measures for disconnecting from the power source. It is crucial to ensure the safety of the rescuer. Immediately cut off the power supply, or use an insulating object to separate the patient from the power source, or take protective measures to move the patient away from the danger zone. 1. Low voltage electric shock. 1. Quickly cut off the power. If the main power switch is nearby, turn it off immediately. Assign someone to guard the switch to prevent others from turning it back on unknowingly, which could cause additional electric shocks. Note that some switches might only control one line and could potentially disconnect the neutral line without cutting off the power due to installation issues. 2. Remove the wire. If the main switch cannot be found or is too far away, use insulated pliers or a dry wooden-handled axe to cut the wire and disconnect the power. Alternatively, use insulated tools like rods, bamboo sticks, plastic, or rubber items to move the wire away. Place an insulating object like a wooden board under the patient to stop the current flow through their body. 3. Pull the patient away. If the patient is lying on a live wire or a leaking electric device, use a dry wooden stick to move them away from the source. Use a dry, insulated rope or twisted dry clothing to pull the patient away from the power source. 2. High voltage electric shock. 1. Quickly notify the power supply department to cut off the power. 2. Wear insulated gloves and boots of the appropriate voltage rating, and use insulated tools of the appropriate voltage rating to open the switch in sequence. 3. Use insulated tools to cut the wires. 4. If the above method is not possible on overhead lines, use the method of throwing a grounding wire to short-circuit the line and cause it to trip. Before throwing the grounding wire, first securely ground one end, then throw the other end onto the live wire. Remember, the end being thrown must not touch the person who is electrocuted or anyone else. This method should only be used in extreme situations, as it can also be dangerous for the rescuer. Important safety considerations. 1. Rescuers must prioritize their own safety. Before disconnecting the power source, never touch the electrocuted person with bare hands, and avoid using metal objects or wet items to rescue them to prevent electric shock. 2. During rescue operations, it's advisable for rescuers to use only one hand to assist to prevent self-electrocution. 3. During rescue operations, rescuers should wear rubber-soled shoes with reliable insulation properties. Stand on dry wooden blocks or rubber mats to insulate from the ground. 4. When rescuing electrocuted individuals outdoors in rainy weather, all previously insulated equipment may lose its insulation due to moisture, hence requiring extra caution. 5. In cases of outdoor high-voltage wire electrocution, be aware of the possibility of step voltage. It is preferable to cut off the power source from a distance of at least 20 meters. If entering or exiting hazardous areas is absolutely necessary, maintain a single-footed contact method to avoid simultaneous contact with both feet. 6. If someone is electrocuted on a utility pole, take safety measures to prevent the electrocuted person from falling from height after disconnecting from the power source, which could lead to fractures or fatalities. 7. Cutting off the power supply may also result in loss of illumination. Consider using accident lighting or emergency lights for temporary illumination. New lighting devices must meet fire and explosion prevention requirements for their use location and should not delay power cutoff and emergency response. What should be done after disconnecting from the power source? 1. Immediate CPR should be performed on individuals with respiratory or cardiac arrest. A defibrillator can be used in the event of ventricular fibrillation. Due to the possibility of apparent death after an electric shock, CPR must be continuously performed until the patient regains consciousness or shows signs of rigor mortis or livor mortis. Do not give up easily. 2. For patients who are conscious and only experience numbness in the limbs, palpitations, and fatigue, they should be moved to a well-ventilated and safe area after being disconnected from the power source. Lay them flat and observe for 1 to 2 hours. Ensure their head, neck, and torso are not twisted, and loosen their collar, shirt, and belt. During this period, avoid allowing the patient to stand or walk to reduce cardiac load and promote recovery. 3. Use clean gauze to cover any burned areas on the patient and avoid applying any medication arbitrarily. 4. If conditions permit, transport the patient to the hospital for treatment as soon as possible. Electric shock injuries can cause significant harm to the human body. How can we prevent them in our daily lives? Let's delve into preventive measures for electric shock injuries. 1. Strengthen safety education. Vigorously promote safe electricity usage. Remind children not to play with light bulbs, plugs, or electric appliances. Enhance awareness of self-protection and mutual protection, and familiarize with preventive measures and rescue methods. 2. Strictly follow electric safety procedures. Adhere to safety production organization and technical measures. Ensure that electric installations and usage meet standards, and conduct regular inspections and maintenance. Promote the use of circuit protection devices. Prohibit the unauthorized extension of electric wires and drying clothes near electric lines. In case of a fire, cut off the power first. 3. Prevent lightning injuries. In areas prone to thunderstorms, pay attention to weather forecasts and adjust plans accordingly. During thunderstorms, avoid working near high-voltage lines, stay away from lightning arresters, do not take shelter under trees, avoid using umbrellas with metal handles, refrain from carrying metal objects, avoid swimming, and do not stay on high ground. Disconnect external antennas at home. When lightning is imminent, if you feel a tingling sensation or if your hair stands on end, be highly alert to the possibility of a lightning strike. Lie flat on the ground immediately to reduce the risk of being struck. All right, this concludes the assessment of electric shock and lightning strike injuries, as well as the on-site first aid measures and preventive measures. Most electric shock accidents are preventable or avoidable, and preventive measures are far more important than post-accident treatment. In our daily lives, we should use electricity safely and responsibly to avoid electric shock injuries and lightning harm.